disease, we can treat the underlying disease easily. Wellness does not only encompass physical health, but also our emotional and
Good
mental
evening to
health.
one and
Mental
all
health
present in this
affects all
meeting.
aspects of life
I am
and can
Nipunika
often
Pandey,
have
editorial
hidden
head
signs
of
such as
Menstrual
hormonal
Cafe.
imbalances. And I am Miss Karishma Bhatia from Unwind Delhi. Treat the underlying disease easily.
It gives
Wellness
us
does not
immense
only
pleasure to
encompass physical
extend to
health,
you a
but
very warm
also our
welcome on
emotional and
behalf
mental
of the
health.
Unwind Delhi,
And one
who has
and
clubbed
all
with
present
Menstrual
in this
Cafe
meeting.
for
I
workshop
am
on the
Nipunika
topic
Pandey,
Effects
editorial head.
awareness about it in all the corners of the world.
Before we proceed further, I would like to request all our viewers to kindly mute themselves and open their cameras for the better interaction. Your coordination will surely help us a lot in the smooth functioning of the workshop.
Now, I would like to extend a very warm welcome to Professor Dr. Payal Mago. Dr.
Before
Mago
we
is
proceed
the
further,
principal
I
of
would like
Shaheed
to request
Rajguru
all our
College.
viewers to
Ma'am
kindly
has
mute
always backed
themselves
us
and
and led us
open
in
their
the right
cameras for the
direction.
better
She has
interaction.
ensured
Your
constant
coordination will
growth for
surely
all
help
the
us a lot in
students.
the smooth
I would
functioning of the
request
workshop.
Principal Ma'am to kindly share a few words of wisdom for the audience members. Now, I would like to extend a very warm welcome to Professor
Ma'am
Dr.
has not
Payal
been able to
Mago.
join us due to her
Dr.
prior
Mago
work
is the
commitments.
principal of Shaheed Rajguru College. Ma'am has always
Now, I'd like to invite Dr. Daya Bharadwaj, convener of Menstrual Cafe. She has always been an eternal source of inspiration for Menstrual Cafe. I would request her to kindly address the audience and enlighten us.
Ma'am has not been able to join us due to her prior work commitments.
Ma'am has not been able to join us due to her prior commitments. So we'll proceed further. Now I would like to invite our guest speaker, Dr. Sameer Kalani. Dr. Sameer Kalani is a senior consultant psychiatrist at Sukoon Health, that is Mental Health Hospital, redefining inpatient care for psychiatry, de-addiction, rehabilitation and RTMS. Sir, I heartily welcome you on behalf of the whole Unwind organization and Mansfield Cafe. Thank you for joining us and spending the most valuable time of yours. We will surely learn a lot from you, sir. Over to you. The floor is all yours.
Thank you very much for inviting me. And equally, I am very happy to be here, especially addressing and especially trying to talk about mental health and the issues that are surrounding mental health, especially with such an interesting topic because I think in psychiatry and mental health, we understand that the body and the physiological changes in right from head to toe in our own system uh, is the primary concern, and then comes later. So this is what we call organicity, and then on the secondary part, the second part comes the psychological or the mental health issues. So I will share this slide that I made, and let us see what we can learn today. And I wish to not only share the presentation, but also I would like to, for every one of us, to have a lot of discussion about mental health and the issues surrounding the hormonal imbalance that we are going to talk. So learned today, and I wish to not only share the presentation, but also I would like to, for every one of us, to have a lot of discussion about mental health and the issues surrounding the are the is the PPT visible?
Yes, sir.
Yes, sir.
It's clearly visible. Very good.
So the PPT was visible.
Is it visible now? Share the presentation, but also I would like to, for every one of us, to have a lot of discussion about mental health and the issues surrounding the is the PPT visible?
Yes, sir.
Yes, sir. It is visible, sir.
Clearly visible. Okay, so this is the first slide.
PPT was visible.
The effects of hormonal imbalance on mental health. Is the first slide visible?
Yes, sir.
Great, great. So let me introduce, our friend has told the audience. My name is Dr. Sameer Kalani. I'm a psychiatrist,
Yes, sir. It is
and
visible,
in our field, before we do psychiatry, before we specialize in psychiatry, we first go through a training in what we called MBBS. MBBS is about learning about the whole body, about the variety of systems in the body, learning each component, first the normal physiological component, then about their pathologies and their importance in the variety of disorders, and then comes the treatment part. When we specialize in the field of psychiatry, we start looking at how the body contributes, how the physiology and the illnesses, variety of illnesses contribute to form what is called the mental illnesses. Today, we are talking about the mental health. What is mental health? This is the state of complete psychological, emotional, and social well being in which we realize our abilities, can cope with the normal stresses of life, can work productively, and contribute to the community. So, this is what we strive for when we say we want to be having a good mental health. There are various determinants when we talk about the mental health, and these determinants, when they have a pathology or the problem, they contribute to the mental illness. So there is a biological, psychological, and social components. When we talk about the biological influences, we talk about the physical health, endocrine system, the immune system. We talk about the neurotransmitters in the brain, the variety of receptors. We talk about the influences which are transmitted downwards in a generation, genetics. Then we talk also about the various foreign particles that enter our body, either through the medications that we take or through illicit substances that we consume. All of these influences get together and they create, to some extent, changes in our system. And they lead to certain disorders. For example, if you see the list, there is autism, schizophrenia, bipolar, attention deficit hyperactivity disorder, OCD, panic disorder, alcoholism, major depression. When we calculate the heritability of these disorders, we find that autism has 90% plus heritability. There is a huge genetic background. Then we talk about disorders like schizophrenia, bipolar disorders. There is a 75% heritability. And as we move down, there is still about a 40% heritability from major depression. This is very different than probability. This is heritability in the sense that the genetic markers that are transmitted down, they may or may not ultimately end to be a disorder. These are basically the influences that contribute to how the illness forms. When we talk about the hormonal imbalances, we specially focus on what is called the endocrine system. The endocrine system is located right from the head. In the brain, we have the hypothalamus, and then we have the pituitary area. From the pituitary area, it goes down to the adrenal cortex and the gonads. Like for in men, it will be the testes, in the female, it will be the ovaries. Then we have hormones which are produced in the system, like thyroxine, growth hormone, prolactin, cortisol, oxytocin, luteinizing hormone, and follicle stimulating hormone, which are the peripheral hormones. In the endocrine system, in these hormones and their locations in the body, there can be certain biological disorders which are for which you go to the endocrinologist or a physician or a gynecologist. And these are like hypothyroidism, hyperthyroidism. PCOS is a very common phenomenon. Hypercortisolism, where the cortisol levels go up. Adenocortical insufficiency, adrenal gland start producing less hormones, so there is a reduction. Hyperprolactinemia, the prolactin levels can go up in the body. And these end up resulting and mimicking psychiatric disorders. So these are not pure psychiatric disorders, these are disorders which originate from these hormonal disturbances. So these mimic psychiatric disorders, like for example, you may have fatigue, you may have anxiety, depression, sleep disorders, cognitive deficits, anorexia, derealization, paranoia, hallucinations, manic symptoms. So what happens when in a psychiatric chamber in a psychiatric practice or in let's say an emergency where a psychiatrist is called because a young person is going through, for example, a mood instability, having some manic symptoms or having some depressive symptoms. So we are trained to first look at the body, look at the endocrine system, look at the variety of systems that are present in the system, in the body, and try to look for any deficiencies, irregularities, imbalances which are there, because they definitely can contribute to and create a system where there is dysfunction in the neurochemical part. And if you end up diagnosing this particular client as having pure psychiatric disorder, then you are doing injustice to the fact that there are underlying influences, there are underlying issues. For example, a client may be having hyperthyroidism and have a panic attack, and we say that, oh, this is a panic attack because there are other factors, but we miss out the thyroid and we do not look at the thyroxine levels in the body. So we have to be very, very aware of the origin of the problem. So the first part we must look at is the biological influences. Then comes the psychological influence. There are a lot of thoughts that we think about every day. There is a lot of environmental factors which provoke us to create an understanding of who we are, which is our consciousness. There is a perception that we have of our environment. We have memories about issues which have been there in the past. We have a certain attention and concentration. We need to be able to perform cognitively. Developmentally, there can be difficulties which are there in the formative years of our lives. And obviously, the biggest concern is the emotion and our ability to be able to regulate the emotion. Any disturbance in these areas lead to psychological influences. And last is the social influences. So in the society, we are at first in the core and individual. Then comes our family, parenting, that we have been exposed to at home. Then we come to the school, where there are peer relationships. There are health services available, and there can be issues there. Then comes to the local politics, comes to the neighborhood, socio-economic status, social support that we have been used to getting to our formative years. What is an individuality and the presence of that individuality in the society, so the reputation. Then comes life events, which we go through. Each one of us have our own life events. We have influences from mass media, now social media also. There can be conflicts which we imbibe because of many events in our life or influences to certain events. And then we cannot forget, apart from the social influences, the cultural origin of who we are. We may try to move away from it, but the cultural influence always remains. So when all these three factors come together, what do they lead to? If there is a pathology in all these three areas, which are those common psychiatric disorders? And this is a very interesting data if you look at it. The National Mental Health Survey. This talks about the prevalence of mental disorders in India, and we have a very high percentage, and this is about 10.6. So if you look at the whole population and if you look at the percentage, 10.6 is a very big figure. And I think substance use, among which tobacco use is the biggest concern in the country. And then we talk about mood disorders, we talk about depression, we talk about stress related disorders, which are the neurotic disorders. We also talk about anxiety disorders. That's the percentage wise flow. Individually, when we talk about depression foremost, because this is one of the most common areas that need to be worked on. Very soon, still not yet, but very soon it will overtake cardiac illnesses to be one of the most common ailments in the world. And it is majorly seen, we majorly understand that depression involves feeling of sadness. There is a lack of interest in work, there is a lack of interest in pleasure, especially those activities which have always been pleasurable, but now we don't tend to enjoy them. In fact, we find them a chore. There can be disturbances in the physiological part, like sleep and appetite, leading to either excessive sleep or undersleeping. Appetite disturbance can lead to excessive weight loss or excessive weight gain, leading to changes in the clothes and the measurements. We have fatigue, we feel a feeling of guilt, worthlessness, decreased concentration, and thoughts of death, suicide. When we talk about the difference in the gender, we find that illnesses can affect us differently. Depression and anxieties are such illnesses which affect more, they are more commonly in women, and there is a significant difference there. Also, there are certain types of depression which are unique to women, and that is premenstrual dysphoric disorder, or like we understand commonly the PMS. We talk about perinatal depression. This could be perinatal means anything to do with pregnancy. So this could be at the time of pregnancy during the 9 months. It could be post delivery. It could be postpartum depression, and it could be also surrounding the delivery time when the hormonal shift is happening. Then at a later age, we find depression which is happening around menopause and the estrogen levels are going down. And so the presentation of depression will remain same as per the points that I shared in the previous slide. But their timeline wise, if they happen at these times, then they have a different label. But we need to understand that the symptoms, the set, and their origin in terms of the neurobiology at the level of serotonin levels, neurohormones of serotonin, will remain the same. So the treatment modalities, or whether it be PMS or it be perinatal depression or it be menopause-related depression, the modality of treatment will remain similar in terms of serotonin replacement that needs to be done. Psychotherapy will always have an individual need base. So when we talk about cognitive behavioral therapy, supportive therapy, crisis interventions, any kind of therapy, it will be disorder independent at times, and it will be individual based therapy. When we talk about depression, we also talk about suicide attempt, we talk about deliberate self-harm, and we talk about completed suicide. But these terminologies, these are events. And these events have a certain role to play, especially if you at times delink it with depression. So with depression, you can definitely have suicidality. But if you delink suicide from depression, you find that there is a different data here. Men, as compared to women, tend to have completed suicide much more than women do. So the ratio is nearly 4 times. However, the events of suicide are basically 2 or 3 times more in women amongst rather than men. Girls from nuclear families, women married at a very young age, are at a higher risk for attempted suicide and self-harm. And both men and women are at the age of between 18 to 29 are equally at risk, however, at a younger age. Females are more at risk than men. This data is corroborated by numerous number of studies. If you guys go on the Google and see the articles, you'll find that this data has been corroborated across the board. So this is very relevant. As a response to failures in life, difficulties in interpersonal relationship, there has been a lot of talk about dowry-related harassment. We find suicide has these important life events. Disturbed interpersonal relationship followed by psychiatric disorders and physical illnesses. Spousal violence has been found to be specifically associated as an independent risk factor for attempted suicide in women. And hereby, we are not talking about depression or anxiety. We are talking about living in an environment where um, there are exhaustion of the psychological resources and direct relationship of the environment onto the mental health of a person. So these are less of biological factors and more of psychological and environmental factors, which require a very different set of intervention that is required at a community level. We have next is generalized anxiety disorder. These in this there is excessive worry occurring most times of the day and at least more than 6 months. So it can't be in the last 1 month I have been worrying a lot about a lot of things. So it has to be more than 6 months at a stretch with anxiety occurring most time of the day for a variety of things: restlessness, poor concentration, irritability, muscle tension, disturbed sleep, constant fear of panic attacks, and prevalence is as high as 4.2 to 5.8%. Bipolar disorder is a common disorder. People have been talking about it openly now. Initially, there used to be doubts about what it is. Now, it's been well established as a biological disorder. In this, there is no gender disparity. It can happen across the board. Manic and depressive episodes are what define bipolar as a combination. So there can be manic episode, then there can be a depressive episode, then there can be a normalcy period in between. Manic episode involves, so we have talked about depression. Manic episode involves elevated mood, grandiosity. There is an increased activity. There is overactivity going beyond a person's personality. There is increased speech, and there is a decreased need for sleep. So the client says that I don't feel like there is no need for me to sleep. So I'm having so much energy. There is no need for me to eat. I'm not feeling hungry at all. I'm quite energetic. So that is what a manic episode is. There are psychotic disorders. Most common is the schizophrenia, which is prevalence is about 1.1%. And in this, there is a distortion at the thought level. So a person's thinking gets distorted, it gets disrupted. And this individual can have a variety of changes in their perception, emotions, and then subsequently the behavior. So this is what we call hallucinations, delusions, and there can be cognitive deficits. Person can not be able to focus on things, confused, and majority of the times in schizophrenia and other psychotic disorders, the individual rarely realizes that he or she is having a breakdown or a disturbance in their thoughts, and they feel they are fine, and the people around will be able to realize it much more. So it's a challenge to at times treat. OCD is a common disorder, obsessive compulsive disorder. Its prevalence is about 0.8%, and there is a presence of obsessions and compulsions. Obsession commonly having an intrusive thought or imagery or phenomena, and there is a repetition of thoughts, there is a repetition of sentences, there is a repetition of a certain urge to do a certain task, which the client realizes that he or she is not like that, and this is very alien to them. And that's where, in order to reduce the anxiety arising from these repetitive thoughts, the client will then end up in doing certain repetitive behaviors. For example, if there is a doubt that my hands are clean or not, the person will end up washing the hands, not to relieve the obsession, but to relieve the anxiety which is arousing from the obsession. So OCD is a biological disorder again. Post-traumatic stress disorder is a response. It's a abnormal situation. It's a traumatic event which leads to a certain response by individuals, like for example flashbacks. After an year of an episode that happened a year back, an event, you still have flashbacks of this event and you relive them. You have those nightmares, there are intrusive thoughts from that event, there is a distress and hypervigilance, irritability, anxiety, poor concentration, decreased sleep, and then it amounts to a disorder. Substance use disorder. We have substance use as one of the commonest problems in our country, and most foremost is tobacco, whether it be cigarette smoking or oral tobacco. There are variations between countries, rates of substance abuse, particularly abuse of tranquilizers, alcohol, analgesics, and this is across the board increasing. increasing all over the world. It's a global phenomenon now. Women are likely to attribute their alcohol consumption or drinking to more of a traumatic event or stressor. And it has been found that there has been a lot of history of abuse. Significantly, depression and anxiety disorders are found very commonly in females who consume alcohol. The profile of women with substance use problems differs from that of males, but because of the increasing rates, it has been found that the ability to stay away from substance becomes more difficult in women than men. And also, the services which can assist these women to get out of this disorder are also very limited as compared to the men. There are disorders called eating disorders, anorexia nervosa, bulimia nervosa. Women account for a major chunk of the eating disorder cases, nearly about 85%. And 65% of those having the eating disorder have binge eating. Most people who develop eating disorders are estimated to be about 90% female, typically associated with adolescent and young women. They also affect middle-aged or elderly women, but there is very little data available, especially difficult to diagnose. People don't come forward at that particular age because of a good amount of stigma to talk about the eating problems. Hence, we have found that this disorder at a later age, between middle age and older age group, tends to go into the diagnosis of depression and anxiety. And often people at that particular age don't want to seek help. So the earlier the better is what is understood in eating disorders. So if you look at the summary, we say 2 times more women attempt suicide than men. About anorexia and bulimia, 3 times more common in women than men. 1 out of every 12 women will develop an alcohol dependence. So if 12 women consume alcohol, one of them will depend on alcohol dependence during their life. More than 2 times women are likely to develop depression compared to men. And more than 2 times they are likely to suffer from anxiety disorders. More than 2 times they are likely to experience post-traumatic stress disorder. Treatment modalities. We talk about treatment, we talk about pharmacotherapy. Since the neurochemical imbalance stems from serotonin, in many cases we talk about antidepressants which are serotonin. Then there are disorders which affect the dopamine levels in the brain, then these are antipsychotics. Mood instability and impulsivity, for them we have mood stabilizers. Anxiety management medicines, we have anti-anxiety medications. Psychotherapy, really, it helps a lot. There are very good modalities of psychotherapy like cognitive behavioral therapy, dialectical behavioral therapy. REBT is rational emotive behavioral therapy. EMDR is very good for traumatic events. Crisis intervention is a must in real life events and any crisis developing. Eclectic therapy is what usually most of the therapists do, is they try and combine a variety of techniques and modalities to try and deliver therapy to a client as per their need. A combination of pharmacotherapy and psychotherapy is determined to be the best approach for any kind of mental illness related mental illnesses or mental health related issues. There are add-on therapies like brain stimulation, whereas RTMS, ECT, VNS, vagal nerve stimulation, deep brain stimulation, TDCS is direct current stimulation, etc. What do we need to do at a larger level? Mental health and society. Community-based support is the right approach to mental health. By that we mean a community that supports, intervenes, prevents a crisis, as well as discourages stigmatization and discrimination. The perception of mental illness within the society is plagued with misinformation, assumptions, negative stereotypes, and a strong sense of those living with mental illness as others. Studies show a positive correlation with social inclusion and positive mental health. This is what I need each one of us to think about and contribute from our end. Thank you. The perception of mental illness within the society is plagued with misinformation, assumptions, negative stereotypes, and a strong sense of those living with mental illness as others. Studies
Thank you,
show
sir. It
positive
was quite
correlation
a
with
very
social
informative session for all of us.
positive mental health.
And if you allow us, we
This
can
is
entertain some questions
yeah, yeah.
by
Each one of us to think
viewers.
about it and
All
contribute.
right. So if anyone has any questions, you can drop in the chat box.
Society is plagued with misinformation, assumptions, negative stereotypes, and a strong sense of those living with mental illness as others. Studies
Thank you,
show
sir. It was
positive
quite
correlation
a
with
very
social
informative session for all of us.
positive mental health.
And if you allow us, we
This
can
is
entertain some questions
yeah, yeah.
by
Each one of us to think
viewers.
about it and
All
contribute.
right. So if anyone has any questions, you can drop in the chat box.
Society is plagued with misinformation, assumptions, negative stereotypes, and a strong sense of those living with mental illness as others. Studies
Thank you,
show
sir. It
positive
was quite
correlation
a
with
very
social
informative session for all of us. And if you allow us, we
this
can
is
entertain some questions
yeah, yeah.
by
Each one of us to think
viewers.
about it and
All
contribute.
right. So if anyone has any questions, you can drop in the chat box.
Society is plagued with misinformation, assumptions, negative stereotypes, and a strong sense of those living with. So, do I answer it straight away? We have some
Thank you,
questions.
sir. It was quite a very Oh, yes, sir. Oh, you
Okay.
can.
So, we have a question about PCOS. PCOD cause brain fog. This is very interesting because PCOD basically means polycystic ovary, and it talks about disturbances in production of estrogen from ovaries. There is a reduced estrogen production.
Oh, yes, sir. Oh,
Directly,
you
it may
can.
not cause brain fog, So but we it have a leads to question metabolism changes in the brain. Because if you look at pregnancy, pregnancy is a physiological state where the estrogen levels are again low and progesterone levels are high. But PCOD is where progesterone is not high and only estrogen is low. So this leads to a problem where metabolism slows down. And in PCOS and PCOD, you have a lot of weight gain. That's one of the major concerns. And that's why many doctors prescribe metformin. So brain fog happens with slowdown of metabolism. So if your metabolism is slow, the energy levels reaching to the brain is also slow. So the brain functioning gets affected. So what do? You exercise. So for each, this is true for all of us. All of us are sitting on this webinar. We're sitting in this environment where we're talking online. We are not communicating offline. We are not interacting offline. So what do? We use a lot of energy in the brain, and our ability to be able to focus and pay attention goes down. So we tire the body in order to recharge the brain. So this works like a dynamo. So same happens with PCOS and majority of the issues. So this is brain fog, irrespective of the reason for what it can happen. You exercise and make sure that your body tires. Brain helps. How to make people not afraid of therapy? So this is interesting. Because a lot of clients have a very skewed idea or their personal view of what therapy is about. Many of them are scared that you will, especially when I'm in a social situation, so this is at least therapy. People, when they talk to me, they're so scared that if one of my friends introduces and says, look, he's a doctor. They're like, oh, hi. And then they say, look, he's a psychiatrist. They're like, oh, you are reading our brain, you are reading our mind. So this is what therapy is all about. So people, when they think of therapy, they think, oh, you're going to get into my head. Nobody can get into your head. We are not hypnotizing you to get ideas of what's happening there. Therapy is about communicating, and it's a bi-directional work. So you bring into something to the table, and the therapist helps you sort it out. And in therapy, it's not counseling, it's a collaborative process of trying to deal with your things where the therapist gives you strategies. So, for each one of us, I would say people do not be afraid of therapy because for a good therapist, once they do therapy to themselves, they are in a position to help you. So, any good therapist will tell you that they do very little. They are basically helping you work with yourself. So there's nothing to be afraid of. Which healthy habits should use to regulate hormones and mental health? Yes. Hormonal changes can happen at an age bracket also. So they can be physiological hormonal changes. Then they can be pathological hormonal changes due to an underlying disorder. So for physiological changes, you have to have a certain amount of education. Each one of us needs to know what changes are going to happen within our own system. At puberty, what's going to happen? Then what's going to happen at a fertile age group? What's going to happen? There has to be a certain amount of sex education. Then what happens in pregnancy? Then what happens after delivery? What happens at a menopausal age? So we are not going to regulate our hormonal shift, but we are going to understand who we are, what to expect, and that will allow you to develop a better mental health. If you are aware of an issue coming up, you can prepare for it. Then, when there is a pathology, suppose there is a hormonal disturbance leading to an ailment, we can still manage our mental health by following certain clear ideas. Number one, we seek help. We never be scared of that. Second, we must comply to what do's and don'ts are given to us. Third, we must not be fearful or we must not feel shy of seeking a review to what we are doing. And I'm talking about the illnesses here. So we keep reviewing it. We keep talking about it with our doctors, with the professionals who take care of that. And you will find that you don't need to reach to a psychiatrist. Your gynecologist, your endocrinologist, your physician will be able to help you deal with your mental health itself. Everyone, okay, so this is questions. Then you know how to know exactly from what mental disorder the person is suffering from, as many mental health same symptoms. That's absolutely right. So the question in this is not about which mental disorder, but the major question is whether are we having a disorder. So when I look at myself, I ask myself this question: is there a dysfunction? Is there a problem I'm facing in my social life, my personal life, my professional? If there is any dysfunction happening at any one of those levels, is there something happening within my system which is contributing to that? If it is contributing from the psychological aspect, like from my emotions, from my thoughts, from my behavior, from my body functions, then I say that yes, looks like I have a disorder. And there is no need to label anyone with that, especially oneself. I'll give a very clear example, you will understand. So this young girl, she comes to me and she talks about, she sits down and she says that I have mood fluctuations. I am having an impulsivity. I have a tendency to harm myself. And I have a borderline personality disorder. So till the first 3 points, I'm fine. When she brings up the name of a disorder, I say, why BPD? Why not something else? So she says, no, I googled it. I did a good search, and this is the profile that it is matching with. So what happens at times is the challenge to a practitioner is that there is already a formulation and already a name of an illness which is there within your mind. And first we have to empty that. We have to let go of that diagnosis. Because it doesn't matter to my client whether it's BPD or BPAD or BPOD or ABCD or XYZ. What matters to my client is how will you make sure that I'm functional? I go back to who I am. How do I continue to grow in my life? And how do I revert to having a good mental health? So I think we can try not to label us, and this I talk to a lot of my colleagues and other practitioners also, that we try to put less emphasis on the diagnosis and more emphasis on the doability of the set of symptoms that we have. we need to resolve them. So, Tushar, I'm very sorry to read this. My father passed away in June 2021, and the memories like always keep revolving in my mind. So, we are talking about grief here, and usually, scientifically, as we understand through a lot of social studies, we have found that about 6 months time duration is a good enough period where the brain goes through a variety of changes, and we call that the grief process. If more than 6 months we continue to have those set of symptoms, we continue to feel grief, experience grief, and it starts affecting the mind in such a manner where our personal, social, or professional life is getting impaired, then we do talk about a phenomena called pathological grief. And in this, I think the professionals have a lot of role to play. So I would suggest, if it is possible, that you talk to a professional psychologist, clinical psychologist, professional, if she or he or she, if they say escalate the matter to a psychiatrist, then there needs to be a clear consult, and we need to resolve if there is any particular diagnosis forming here. Then we have unwind. Okay, is there any role of hormonal imbalances schizophrenia? So schizophrenia in itself is a disorder of dopamine. Dopamine imbalance creates a lot of issues in thoughts. When you talk about schizophrenia, you also talk about an inability of a person to be able to take care of their self because of their thought process. So it is not directly related to hormonal changes, but indirectly it is related in the sense that the person's self-care gets affected. For example, I have a client who ends up eating a lot, resulting in obesity and then leading to PCOS. So there can always be an indirect hormonal imbalance happening in the periphery. Neurochemically, yes, the dopamine is also a hormone, and dopamine disturbance is what causes schizophrenia. Then, if we are not going to, okay, that's true. If we are not doing well with everything, every voice just disturbs us, just like panicking and breathe breaks. Is it not normal? So, okay. So I have this interview tomorrow, and I'm going to sit in an interview, and I'm shivering when I enter the interviewer's room, and I sit down, and I'm not able to speak properly. I walk off the interview, and I'm like, oh my god, what has happened? What did I do? So what happens in a particular situation is that our reactions to a situation dictates the severity of that situation. So panicking, not being able to breathe, feeling very restless, feeling very anxious is fine, and there is not a question of being normal, so it's fine. But we need to keep working ourselves to be able to manage a particular situation much better. I can train myself to be able to deal with the subsequent interview better than my previous interview. And over the sense of over a period of next few weeks, next few months, I train myself better in the sense that okay, my next interview would be better than my next. My third interview from tomorrow would be much better than tomorrow's interview, and that's how I grow in life. But if despite my training, if despite my preparation, if despite not being able to function at subsequent and then serially interviews, that and it starts affecting my performance, it has a setback on my profession, then the whole question comes down to why I'm not able to manage my anxiety. And that's how I grow in life. Then it comes down into the domain of what we call an anxiety disorder. And for anxiety disorder, the durations have to be at least around 6 months. It can't be just few days, few weeks, and few months. It has to be at least 6 months. And then we say that yes, definitely there is a disorder. Is diet and hormonal hormone balance in body related with each other. So this is interesting because there is a lot of data surrounding the biological, psychological, and environmental factors. But there is now another domain which has come into play, which is called lifestyle. Lifestyle has number one exercise, or I should say the lack of exercise. Second point is diet or lack of proper diet. So, an imbalance in diet and lack of exercise have started contributing to huge number of not just mental health related issues but a lot of physical issues. So, right from a very young age, we need to train ourselves in to be able to do at least 10 to 15 minutes of exercise every day and follow a good balanced diet in terms of carbohydrates, fats, and proteins, and any kind of micronutrients that the body needs. That is again age dependent on the variety of physiological changes happening in the body. If you are deficient in certain vitamins, there will be direct hormonal imbalances in your system. And that's why earlier there never used to be a tests available. Nowadays, a lot of labs have come out with a lot of tests of a lot of hormones. And that's a good idea to consult an individual first, practitioner first, before you start worrying about vitamins and supplements and go into that frame of mind. Diet, nutritional, if you look at nutritional education, you see, talk to dietitians, they will talk to you about balancing diet in terms of not just the calorie content of it, but also in value in terms of the protein and the fat content. And diet is very important. When a person shivers, vomits out of anxiety, starts getting restless, shortness in breath, starts feeling like they're going to faint, their brain kind of numb, they cannot sleep because they get up in shock every time they try to sleep. What level of anxiety is this? I think anxiety is severe. There's no question of this because the physiological changes. So shivering, there's tremors, shivering. There is a GI reflux, vomiting. There will be, I'm sure, nausea also. Breathing, you feel as if your chest is constricting, and the brain kind of feel numbs again, sensory phenomena. So what happens is that this usually kind of anxiety is what we call panic attack. And this panic attack lasts for usually few seconds to a few minutes. But the experience of this anxiety is very severe. It's a very disabling sort of anxiety. This is hyperactivation of the nerve endings all over the body. And these nerve sensitivity, nerves hyperactivity leads to this physical experiences that the person is having. So this is something, if happening over a period of time, warrants serotonin replacement in the system. It will always be accompanied by some amount of mood, sleep, disturbances. So then we have the next question. If I have OCD and unwanted thoughts occur in mind, keep disturbing me all day and create stress because of which I'm not able to focus on what I'm doing, but it is not visible through my actions. So what can I do to cure it? So this is there are two common phenomena in OCD. First, there has to be a disorder, so then it becomes OCD. If it is at a disorder level, there can be two phenomena. One, there can be only thoughts, not translating into compulsive behavior. So OCD predominantly obsessions, leading to excessive, repetitive, intrusive thoughts, not allowing the person to read, so the person is reading and there's this thought coming in like that, and you're not able to focus on what you're doing. You can't ignore these thoughts, you can't keep them on the side. So this is also OCD, predominantly obsessions. Then you can have thought action, repetitive thoughts, repetitive action. So that will be OCD mixed type of predominant obsessions as well as compulsions. So in order to deal with the problem, you have to go to a doctor, go to a therapist, do a combination of pharmacotherapy and psychotherapy. And they are able to then help you be able to focus and You can thoughts are coming like this, and you keep pushing them away, and then they are not existing anymore. So it's a biological phenomena compounded by your behavior. So psychotherapy helps you deal with the thoughts, and biological therapies help you resolve the thoughts. So I have a comment. Thank you so much, sir, for very informative talk based on what you just said regarding labeling individual, even self, and focusing more on treatment and getting more functional individual. What to do if labeling helps individuals in some way feel less alone or more understood and validated? Yes, so that's not label, that would be identity. What if the label provides an individual with a sense of I am not alone? That's again your identity, because you're there with yourself. What should be done when the disorder is of a type which might make a person act in the way that satisfies the label? No, there always remember this. Human brain is a very powerful organ. It's one of the most powerful organs which is available in our whole system. What should be done? Question, the last part is what should be done where the disorder is of a type which may make a person act in a way that satisfies the label. Now, this is true for everything. I am having fever and having a little bit of sore throat, and I'm feeling uncomfortable, and I get my COVID test done, and it comes COVID positive, and I start behaving like a COVID client. Whereas till I got my COVID test done, I was behaving like a flu patient. Oh, I have got flu. No problem. But now I have got COVID. I have COVID. I don't have flu. I have got COVID. So this is true for everything. And the worst part is that in mental health, the label is unsubstantiated. So what does my client understand by if I tell my client that look, you have got bipolar, you're not got borderline, you've got a border bipolar disorder. So he or she has very limited understanding on the depth of that disorder. For him or her, it does not matter whether it's borderline or bipolar. For him or her, it matters. This is how do I solve my issues? But if we talk only about the label, if we talk only about the disorder, we start behaving in that particular manner. So, what we need to do is, at the time of discussion about the diagnosis, I'm not saying don't discuss the diagnosis. At the time of discussing, understanding the diagnosis, try and have your clear targets as to what is it that you want to do with the set of problems that you have. When we talk about schizophrenia is such a loosely combined diagnosis. There are so many symptoms across the board where two certain symptoms cannot be in the one individual at the same time. So we in psychiatry and mental health, especially if you talk to a good psychologist, they'll tell you that these formulations, these diagnoses are more for the clinician and less for the client. So for the client, it is very important to be able to create and understand their own identity. And your identity is not your label or diagnosis. Your identity is who you are, where you are, how you're dealing with what is happening around you, what has been, what is, and what's going to be. So this is much bigger than one diagnosis of bipolar or borderline or schizophrenia or depression. So we have to work on who we are, and we have to be better than who we have been, not who anybody else is doing. That's the best way to compare. What has been, what is, and what's going to be. Thank you. This is much bigger than one diagnosis of bipolar.
All right, so I guess everybody have got the answers of the question. Thank you, sir. It was really a great to have you here, and your examples which you have told were fantastic, and it helped us to understand and give better knowledge. So, it's Nipunika here. I would like to call her. So
Everybody have got the
we are
answers of the
grateful
question.
that we got a
Thank you, sir.
chance to
It
learn
was
from you.
really great
This
to
was
have you
indeed a
here,
conducive
and
session.
your examples
We
which
all
you
must have
have
grasped
told
something new today.
are
Unlearning
were
what's
fantastic,
obsolete
and
is
it helped
essential
us
for
to
growth in the right
understand
direction.
and
As
gain
somebody said,
better knowledge.
we are the
So
custodians of our
it's
bodies.
Nipurne ka
We
hai
must take
to
action to
call
employ
her.
healthy lifestyle habits to prevent,
So I
reduce,
guess
or manage disease and illness.
got the
With
answers
this,
of the
I
question.
would like to call Jigyasa, the president of Menstrual Cafe Rajguru, to offer the vote of thanks.
Your examples
We
which
all
you
must
have
have grasped
told
something new today.
are
Unlearning
were
what's
fantastic,
obsolete
and
is
it
it's
helped
a
essential
us
for
huge
to
growth in
privilege
the
for
right
me to
direction.
be able to
As
deliver the
somebody
word of
said,
thanks to
we are
such
the
exceptional
custodians of
people
our
today.
bodies. We
Firstly,
must take
I would like to
action to
present my
employ healthy
heartfelt
lifestyle
gratitude
habits
to our
to
special
prevent,
guest, Dr.
reduce,
Daya,
or
the
manage
convener
disease
of our
and illness.
initiative for her
With
constant
this,
guidance.
I would like to
Moreover,
call
I thank
Jigyasa,
our
the
amazing
president
faculty
of
and
Menstrual
team of
Cafe
Sachi Saheed.
Rajguru, to offer the vote of
I
thanks.
would also like to thank Dr. Samir Kalani from the bottom of my heart.
Unlearning
Thank you so much, sir, for taking out your time for us from
to
your
be
busy
able to
schedule.
deliver the word of thanks to such
I'm utterly
exceptional people
grateful to
today.
the Menstrual Cafe of the college. Last but not least, I thank our wonderful audience for taking out the time for this and joining us. Hope we were all able to learn a lot from this and would have something knowledgeable to take further in life. Finally, I leave you with an inspiring quote. Mental health is not a destination but a process. It's about how you drive, not where you are going. Thank you.
Thank you, everyone.
Last
Bye
but
bye.
not least, I thank our wonderful audience for taking out the time for this and joining us. Also, there's a feedback form in the chat box. Please fill the form in order to get your certificates for the session. Finally, I leave you with an inspiring quote. Mental health is not a destination but a process. It's about how you drive, not where you are going. Thank you.
Thank you, everyone.
Last
Bye
but
bye.
not least, I thank our wonderful audience for taking out the
Everyone
time.
switch on their videos
Also,
for
there's a feedback form in the chat box. Please fill the form in order to get your certificates. Everyone, please switch on. I leave you with an inspiring quote. Mental health is not a destination but a process. It's about how you
everyone
drive,
switch
not
on their
where you are
videos
going.
for
Thank you.
a picture for a
Thank
group
you,
picture
everyone.
please.
But not least, I thank our wonderful audience for taking out the
Everyone
time.
switch on their videos
Also,
for
there's a feedback form in the chat box. Please fill the form in order to get your certificates. Everyone, please switch on. I leave you with an inspiring quote. Mental health is not a destination but a process. It's about how you
everyone
drive,
switch
not
on their
where you are
videos for
going. Thank you.
a picture for a group picture please.
But not least, I thank our wonderful audience for taking out the
Everyone
time.
switch on their videos
Also,
for
there's a feedback form in the chat box. Please fill the form in order to get your certificates. Everyone, please
thank
switch
you
on.
everyone.
Mental health is not a destination but a process. It's about how you
Everyone
drive,
switch
not
on their
where you are
videos
going.
for
Thank you.
a picture for a group picture please.
But not least, I thank our wonderful audience for taking out the
Everyone
time.
switch on their videos
Also,
for
there's a feedback form in the chat box. Please fill the form in order to get your certificates. Everyone, please
thank
switch
you
on.
everyone.
Mental health is not a destination but a process. It's about how you
Everyone
drive,
switch on
not
their
where you are
videos for
going. Thank you.
a picture for a group picture please.
But not least, I thank our wonderful audience for taking out the
Everyone
time.
switch on their videos
Also,
for
there's a feedback form in the chat